Hello, my name is Megan Raby, and I'm going to speak about the role of a nurse practitioner. So, what is a nurse practitioner? According to the American Association of Nurse Practitioners, a nurse practitioner is an advanced practice registered nurse who has obtained a graduate education level at the master's, doctorate, or postdoctorate level. Nurse practitioners care for patients across the lifespan by providing assessments and diagnoses, initiating and managing treatments, ordering and interpreting lab tests, prescribing medications and non-pharmacological treatments, educating and counseling patients, as well as coordinating their care amongst disciplinaries. How does a nurse practitioner differ from a physician's assistant? According to the American Academy of Physicians Associates, a physician's assistant is a licensed clinician that can practice medicine in every setting and specialty. Physician's assistants have a master's level of education, but also a bachelor's degree in behavioral and/or basic sciences. While advanced practicing nurses have bachelor's degrees in nursing, they focus on their patient focus is on a nursing model of care, and physician's assistants use a more medical and disease-based model of care that has a lot of science background to it. How does a nurse practitioner differ from a physician? Well, nurse practitioners have less training than physicians. Physicians typically go to a 4-year undergraduate school and obtain a degree, followed by 4 years of medical school. They then participate in a residence or fellowship, and that can last anywhere from 3 to 7 years. Physicians tend to delegate tasks to assistants, such as analysis of medical tests, while nurse practitioners will perform the analysis themselves. Studies have revealed that among patient satisfaction surveys, there are patterns that show nurse practitioners are rated equally or higher than physician colleagues. So why don't you just become a physician? Well, I didn't need a slide written out to answer this question. I feel like I can just answer it on a whim, and that is nursing has just always been a passion of mine. I've wanted to be a nurse since I was a child, before I even knew really what the difference was between a nurse and a physician. As I went to nursing school, I realized that it is looking and caring for a patient holistically, looking at a patient and caring for them holistically, mind, body, soul, physical health, all taken into one consideration. I do think physicians, there might be some that have that point of view, but they more often than not see a disease or a specific problem related to a specific organ versus seeing how the patient is feeling overall. I think also that the schooling played a part in that decision. As when you're a teenager or a high school aged individual looking at colleges, it is daunting to think of going to medical school. So that also kind of swayed me. But now that I've been in the role for 19 years, I would not want to do anything else. And I also think it's important, I will be a nurse practitioner at the end of this program, but I'm very proud, and I do truly believe that being a nurse for many years leading into this role is only going to help, because I have so much experience providing that type of care, that holistic care, and seeing that there's more to people than just their disease or just the individual problem that they might see at that time. So that's my answer to that question. I'm super excited to become a nurse practitioner, and I think I can provide that type of holistic care that patients require. Thank you.